Hey everyone! If you're getting ready for knee replacement surgery, you might be feeling a mix of excitement and nerves. I'm here to help you get fully prepared so that your surgery and recovery go as smoothly as possible. Today, I'm sharing the top 5 essential steps you need to take before your knee replacement. Hi, it's Daniel from Supply Physical Therapy, where we help people get back in motion. If you are new here, make sure you click that subscribe button and all the links to everything we mention in the video, which you can find in the description box below. Let's jump right into it. People have knee replacement surgery for a number of reasons, and here are the most common ones. Arthritis, fractures around the knee joint, certain types of sports injuries, cancer. When you are facing a knee replacement, it's better to prepare ahead of time. What's the old saying? Failing to prepare is preparing to fail. Here are the top 5 things to do to prepare when facing knee replacement surgery. 1. Speak with your doctor and ask questions. Have a candid and open conversation with your doctor. Ask the right questions for your specific case, especially if you have any medical conditions the doctor needs to know about. Here's a list of some common questions. What does the surgery entail? How long will the surgery take? How long is the recovery? When can I go back to work? Resume daily activities. What are the success rates, risks associated with this procedure? Am I a candidate for a partial replacement? Have we extinguished all alternative options? What are the costs associated with the surgery? Should I get a second opinion? 2. Consult with your healthcare team. Medical evaluation. Ensure you're fit for surgery with a thorough evaluation by your surgeon and primary care physician. Medication review. Review all current medications with your doctor, especially blood thinners and supplements, as some may need to be paused before surgery. Metal allergy. Some knee implants are made of cobalt chromium, specifically nickel. It is recommended to get patch tested or tested by an allergist. Donating your own blood in case it's needed for a transfusion. Stop smoking. Ask if a healthy weight loss modification is needed. 3. Prehab. Strengthening. Focus on exercises that strengthen the muscles around your knee and your core. Flexibility. Work on maintaining or improving your knee's range of motion. Physical therapy. A physical therapist can guide you in a tailored exercise plan for surgery. 4. Prepare your home for after surgery if you are not going to a skilled nursing facility. Make your home safer and more accessible by removing trip hazards like rugs, installing grab bars in the bathroom, and arranging for a raised toilet seat. Obtain assistive devices such as a walker, crutches, or cane, as well as a reach or grabber tool and other helpful items. Create a comfortable safe zone. This area should include essentials such as a comfortable chair or recliner, a table to hold items you may need, and entertainment options like books, magazines, or a television. Meal preparation. Stock up on easy-to-prepare meals, snacks, and beverages to minimize the need for cooking. Consider preparing meals in advance and freezing them for easy reheating. Make sure your bed is set up and comfortable after surgery. 5. Plan your post-surgery caregiver assistance. Arrange for someone to help you with daily activities, especially in the first few weeks after surgery. Transportation. Organize transportation for the day of surgery. A large 4-door vehicle is best if possible. Arrange for help with the nurse or staff at the doctor's office if you do not have one. There will be a transportation cost here, so ask about it. Plan to have someone the first night at home. Plan pet care and child care. Plan for household chores like laundry cleaning and yard work. Home health care for things like nurse care, blood draws, and PT. Rides to and from PT when needed. Thank you for watching this informative video on knee surgery. If you found this helpful, don't forget to hit that like button, comment below if we missed anything that helped you, and more importantly, subscribe to our channel for more healthcare tips and information. Let's get moving again.